Hello, I'm Nyauni Boaz, an oncology nutrition specialist student, and I'd love us to talk about the very basic concepts of cancer. And first, in my outline, I look into the definition of cancer, the warning signs of cancer, and also look into the cancer cachexia syndrome. So in the background, in a bit of cancer background, cancer is one of the major non-communicable diseases which, together with cardiovascular, diabetes, and chronic respiratory diseases, cause over 60% of global mortality every year. And back home in Kenya, cancer ranks third as the cause of morbidity and mortality after infectious and cardiovascular diseases. And cancer is a term used for diseases in which abnormal cells divide without control and are able to invade other tissues. The characteristics of cancer, the first one, cancer is self-sufficient in growth signals. Cancer has its own growth signals. The second characteristics of cancer is sustained angiogenesis, which is the ability of the formation and development of new vessels. Then there is tissue invasion and metastasis. Cancer cells are able to invade other organs and are able to metastasize from the area of primary tumor, to other distant organs. Then the fourth characteristic of cancer is a version of apoptosis, which is the death of cells. Then there is limited, then it's sufficient in sensitivity to anti-growth signals. So in the warning signs of cancer, there are 6 major warning signs of cancer, which are abbreviated as caution. So the first one is change in bowel or bladder habits, a sore throat that does not heal, unusual bleeding or discharge from body orifice. Then there's thickening or lump in breast or elsewhere, indigestion or difficulty in swallowing, obvious change in warts or mole, and there is a nagging or hoarseness of the voice. So cancer cachexia can be defined as progressive deterioration with mucosal wasting that occurs when proteins and calorie requirements are not met. Cancer cachexia is characterized by anorexia, weight loss, skeletal muscle atrophy, and loss of strength. The risk factors for cancer cachexia could be disease-related, like in the case of pancreatic cancer or gastric cancer. Then treatment related, for like example, chemotherapy, surgery or radiation therapy of the head or neck. Then situational related, like when one has depression or absence of appetite. The complications of cancer cachexia could be like increased morbidity and mortality, altered carbohydrate, protein, and lipid metabolism. There is impaired immunity, poor wound healing, and protein calorie malnutrition. The management of cancer cachexia include, the first one is treating the underlying cause. Then the second one could be the pharmacological interventions like use of medroxyprogesterone, which is used to increase appetite. and corticosteroids like prednisolone, also which increases appetite. And there could be also an option of total parenteral nutrition. So thank you.